Hey, what's up everybody? Dr. Bree from Empower Physical Therapy here again to help you build a resilient body and mind. Today I'm going to be showing you some exercises you can do if you have shoulder pain, rotator cuff pain, shoulder impingement, things like that. These are some great exercises that can help you kind of put out the fire of a flare-up. They're not necessarily meant to strengthen anything or mobilize anything. They're really just there to help calm down your symptoms so that you can go about your day. It's called the pendulum, and this can really help to kind of calm down the tissue. What you want is a surface that's nice and sturdy that you can rest your non-injured arm on. So your arm can be here or it can be down here, and then this arm is just hanging and you're letting gravity kind of pull it down. Now, a common mistake I often see is people try to use this arm actively. So what I mean by that is they try to just move the arm. And that's not what we want here. And the reason for that is because we're not trying to make these muscles do work here. What we're trying to do is just slightly separate the joint space to let some fluid get in with oxygen and nutrients to help it calm down. And also doing this kind of slight oscillation movement is shown to simmer down some of that pain. So instead, I want you to think of like an elephant trunk just hanging, dragging on the ground, okay? So my arm is not doing anything here. Instead, I'm shifting my weight from one leg to the other, forward and backward, going in circles, one way and then the other. And as a result, yes, my arm does move, but not because that's the primary purpose. This can be done as often as you want. It's not gonna harm any tissue. So you could use this every hour if you want to, for 15 to 30 seconds or more, whatever helps you calm your symptoms down. It's called shoulder isometrics. And I give you a warning in advance and an apology. They're a little bit boring, but studies do show that isometrics can be excellent at calming down symptoms. Again, we're not strengthening anything here. We're just getting those muscles on. It's called setting them. And we're just trying to keep them active because two things happen. Sorry, there's some construction happening outside. Okay, so two things happen when you have pain. Either one, those tissues just shut off completely and they stop working because it hurts, or muscles around it spasm and they tighten. So we're gonna go 4 different directions. So it's called a 4-way isometric. You just wanna have a soft towel or something to cushion your hand. The first one is shoulder flexion or going forward. Now all of these are gonna have the commonality of a nice 90-degree bend in the elbow, and the rest of the body is still. So we're not leaning, we're not twisted, we're not moving the elbow. It just stays nice and glued, okay? And now what I'm doing here is I'm pushing into the wall, and it's almost imperceptible. You can't even see it, but if you were to feel the shoulder, you would feel it engage. So what I'm not doing is I'm not leaning forward, okay? I'm not doing a really like straining, gird, not a hard push, okay? Just a little bit of a pressure. And the cool thing about this is you can give as much or as little pressure as you want based on what your symptoms allow. And in fact, simply holding the towel against the wall and not letting it fall down, that by itself is getting these muscles on. You're going to engage these muscles. You're going to hold for 6 seconds, relax for 6 seconds, and you repeat that 6 times. So just remember the number 6. Hold for 6, relax for 6, repeat 6 times. So that's one direction. And if you can, if you have the time and the patience, I'd encourage you to actually give it a try on your arm that is not painful so you can know what it should feel like first. So that's direction 1. Direction 2 is simply the opposite. You go backward. So again, everything's straight in line. I'm not twisted, okay? And I'm not moving my elbow. It stays nice 90 degrees, and I'm pushing back. Again, I'm not pushing the shoulder forward. You can barely even tell I'm working unless you felt back here and you would feel it engaged. Same repetitions. Hold 6, rest 6, do 6 times. The last 2 are for rotation. We're gonna start with external rotation. So in this case, it's almost like you're opening a door, and I wanna be clear, we're not pulling away like this into abduction, we're rotating out, okay? So the elbow stays glued to the side. Again, couldn't tell. If it helps you to feel the muscle in the back, that's great. Same exact rep scheme. Last one is internal rotation. So before we open the door, now we're gonna close the door. And again, close the door, not coming in like a deduction. And in this case, you want the towel on the inside of your hand. Same thing. And if you want to feel this one, you might feel it in your armpit. That's where you might feel that muscle engage. Okay, so those are isometric. What we're gonna do are called scapular sets. So I already have a video about scapular squeezes, but these are for the lower trap. So we have our upper trap up here. I also have a video on how to self-release that with a tennis ball, lacrosse ball. But you can release this all you want, and that's fine. But if you don't get the muscles in the middle trap and the lower trap to simmer down, you're just gonna have the same symptoms. So it's gonna start to creep back up. So you can release this upper trap area. Sometimes with rotator cuff issues, releasing your pec can also feel really nice. But then you need to strengthen the opposing muscles, okay? So I'm gonna show you because I have to turn around. But basically what I'm doing is, if this is the upper trap engaging, and this is the middle trap squeezing, what I'm doing is I'm simply lowering down, sliding my shoulder blades down, okay? So it's a little harder to see because there's not as much motion. We have a lot of motion going up, we have a lot of motion coming back. We don't have as much motion going down, depressing the scapula. Okay, so it's okay if it's not a lot there. Just sliding down like you're trying to tuck your shoulders into your pockets. And we can do these for holds, so you can slide down and hold for 5 seconds and then relax. Or you can do them for repetitions to get a little more strength rather than a bunch of endurance. If you like this video, please let me know in the comments below. Give it a thumbs up, hit that subscribe button, and I would like to know what other type of content you would love to see. As always, thank you for watching.